Hiya, darling. Take a couple of big breaths with me. In through your nose. Out through your mouth. Again. In through your nose. Out through your mouth. Today, we're going to be doing some work with a wall and a ball. An air-filled ball is best for this, but if you don't have one, a tennis ball or a lacrosse ball will work fine. Just make sure that you're not using too much pressure. We don't want to crush the tissues, we want to stretch them. Take the ball, place it underneath your collarbone and to the side of your sternum. Come over to your wall and lean into it. This should not be painful. Discomfort is fine. Pain is not. If it's painful, you're crushing the tissues. We don't want to crush the tissues. That's counterproductive. We want to stretch them. We're going to hold each of these stretches for upwards of several minutes. I'm actually going to do a series with the collarbone, the arm, and the shoulder so that you can keep along with me and have enough time to properly sink into these tissues. You don't want to take too little time or else the tissues won't stretch fully. By taking at least 3 minutes with each stretch, that allows your body to fully open and that gives you a chance to relax into whatever it is that we're doing. Big breath. As we're doing this, you may notice some discomfort elsewhere. In your ribs, in your back, maybe in your shoulders. I notice when I work with the collarbone that it engages some of the pain that I have in my hands. Being a body worker, my hands get put through a lot of things, and I've been doing this for 11 years. So my hands are not always in such good shape. I notice that as long as I'm doing my self-care, my body's able to relax and open. That gives me better blood flow, better energy flow into my hands and lowers my overall pain levels. This can also help if you have pain in your hands, your wrists, if you're showing carpal tunnel symptoms. Our nerve pathways have to pass through muscles that attach to the collarbone. Making sure that your collarbone is open and it's able to move properly can help quite a bit with hand and wrist pain, as well as a lot of the shoulder stuff. Take one more big deep breath. When you come out of this, come out of it slow. Don't just push off the wall. Come out of it slow. And you may notice some redness on the skin. That's normal. That's blood flow that's coming up because we've been putting pressure there. Let me know what you think about this one, and I will be back with another one moving down the collarbone into the shoulder so that we can open up some more things.